pulled to the oxygen. So with these two symptoms, the drug prescribed was Paris quadrifolia, and that is of 200 potency. It was in the time of evening, so his accompanying person, his friend, came to my clinic. I had given him one dram of this Paris quadrifolia to tell him to take just now and when you will go to the sleep. And the next day, I was in Kolhapur. So there was some university work, I had gone there. Around about 3 p.m., one phone call came from his daughter that the temperature of the person is 99 for the first time in last 10 days. So 2 doses already the man had taken. So I had gone for the 3. The same medicine continued. At night it again became 100 degrees. But since morning there was no temperature. So 15 days after he got his body temperature normal. So 2 doses more were given and the medicine was stopped. And after 3 days, the patient became alright. There was no fever, but residual weakness. So that is apparent and that should be stayed. So no Calpol, no other antibiotic which could not reduce the temperature since last 15 days or more than 12 or 13 days. So by 2 or 3 days this was done miraculously by homeopathic drug, and the drug was Paris quadrifolia. So while we are prescribing for acute conditions, this knowledge of materia medica absolutely helps you. And this kind of totality, when you are able to join these symptoms, you can time these symptoms. So that gives marvelous and miraculous result. I would like to share another case. So this is a chronic case and we are just treating the acute exacerbation, or you may call it is a chronic case with few acute symptoms. This is a very interesting case, and one day I will try to present this case again. So it was a case of a patient, a female patient. He was of 63 years of age and she is a diagnosed case of dilated cardiomyopathy. It was diagnosed since last 3 years. The lady was taking beta blockers. He was taking angiotensin 2 receptor blocker, lanoxin, some diuretic, some aspirin, etc., etc. So it is continuing, but without much relief to this patient. Because the condition became worsened. And there was no hope came from this allopathic physician side for this acute complaint. They are telling him repeatedly, hospitalize, hospitalize, etc. So this homeopath got a chance to treat this case, at least to see this case. So when the report came before us, so her left ventricular ejection fraction, so that was 90 to 20%. And it was a case, as we have said, this is a case of a dilated cardiomyopathy, almost incurable condition. Now the patient presented with symptom, with a very low voice she was talking. She was laid on a bed and there was 3 or 4 pillows below his bed. Means a propped up position was giving some relief to this patient. There was constant cough, and this cough was dry, it was not productive. There was swelling over the feet, yes. And she was talking in small sentences because she has got some respiratory distress that her voice and her speech was almost monosyllabic. She was not talking more. Slowly she was talking. And very important thing is, she lost his hope of life. She said it is the time that she should die. The condition of the patient was very poor. And if you, being a physician, is going to treat this case, there should be some urgent relief. Say there should be some relief in the cough or breathlessness or whatever, through which she can get some confidence. Yes, I can live for more few days because the suffering was too much. Gradually, the function of the body is not getting blood supply. Ejection fraction is 20%. It's very dangerous condition. So in such case, we prescribe Loroceresus 30. Because it is a case, hopeless case, so we cannot give high potency. The susceptibility is too poor. The body will not accept higher cases, higher potencies. So Loroceresus 30 TDS, that was given for 3 days. Initially there was no relief, first day. Second onward, the intensity of cough getting gradually less. Patient regularized the remedy. There was steady improvement. But after the 7th day, all the symptoms came back. But the intensity was less. So after prescribing 3 days, 3 or 4 days, she was perfectly alright. Means cough and breathlessness was less. And after 7th day, all the symptoms again came back. But for the family, people told me, even I have talked to telephone to this patient. She said, yeah, it is increased, but the severity is less than before. Again, Loroceresus. So that was 30 TDS for 3 days. And gradually, we are seeing the improvement. Cough was less. Sleep good. Good benefit in breathing difficulty. Swelling over the feet was also less. Limited working in the room. And comfort was in better too. So this was a acute condition. So that was handled by this. If you study Loroceresus, you will see it is a very good remedy for cough with dyspnea. And which is aggravated on sitting up. In recumbent position or lying down, it is better. It's a very atypical symptom. There is cough with valvular heart disease. Look, when our Mathematica was written, the disease diagnosis was not that much better, proper, like today. So might they have got some valvular heart disease, and because in any condition of a heart we get such kind of symptoms. So Mathematica writes is valvular heart disease. But don't make it particularized, make it generalized. Now the patient continued the treatment with some constitutional drug. And I am very proud to say that the patient in recent latest of his ejection friction, left ventricular ejection friction, so that is raised to 38 to 40%. The patient is perfectly alright, but there is a chronic condition. I will be talking later when we speak with chronics. But the acute is to be handled equally. And because acute was correctly handled by us, the patient continued the treatment. And as I have said, gradually the whole family, his friends, so a lot of patients. So they send us. And this thing will happen with every homeopathy, because acute, if it is handled in a right way. Then few days back, a boy of 10 years. That was a time that is almost 9 past 15, 10 past 9 plus 45 something. But that time I was ready to go. I just came out from a clinic and one aged lady, she stopped me. She told doctor, my grandson, who is of 10 years almost, is suffering with some disease, please do it. The condition is not good. Now acute, try to feel it. So I stopped. She said they will be coming by 5 minutes, but almost 15 minutes have passed. So I asked, what happened? So the lady said, exactly in front of my clinic, one pediatrician runs a successful clinic. So that particular boy is there with this clinic of that doctor. I asked, what happened to your grandson? She said, that she had developed arterial rash through all the body. And that is since 3 days he is taking that allopathic treatment. But there is no remission of symptoms. And no change. So now this is obviously an interesting case, because a boy is taking or suffering and he had developed urticaria, even allopathy remedy is not getting any result to this case. And with lot of hope the people came to you that whether anything can be done by this homeopathy. Now I asked several questions, whether any food he had taken, whether any new shirt he wore, whether a new place he visited, whether another towel, the dust, whether he played in the ground. What can cause the urticaria? I asked all the questions. But no information I got through which I can select, but this is the reason for which the boy had developed urticaria. Now meanwhile the boy came. He was enormously swelled, yes. The face was large, it was red. He was very slow to enter. He sat, and I see she has got a very vacant kind of look. This case is, always challenging. The body is swollen, but the face is swollen, it is red on one. If he applies any cold, the itching intensifies. Sometimes a wave of chill comes and he gets a cough. Because his brother got cough. So they were not now running AC. This boy is a hot boy, as her mother said, without AC he cannot live at all. But he is tolerating this heat. So we are getting the cold aggravation, patient chilly. So the picture is suggesting almost towards arsenic or such kind of remedy. But still I was in a dilemma. If something new come out, I don't know why this kind of feeling was there in my mind. Probably the boy was so much swollen, so that had created a lot of anxiety in me also. When I asked a bit more, the boy said the urticaria, sir, it is painful. So painful urticaria. So one clue came. And regarding past history, because still I am not getting any drug. So I asked his mother whether this boy develops urticaria before or it is the first time in life. His mother said, no doctor. He gets kind of small urticarias. I asked when? After eating anything? No doctor. Not eating. But when he comes from the playground, or if he runs, if he dances, so sometimes, occasionally, I have found few red big patches, that is, articular lashes on abdomen, belly, sometimes on neck, sometimes on face. But that were short lasting, they passes. So we have got two symptoms. One is urticaria painful and second, urticaria exertion after. We prescribe Bovista to this case. Bovista 230 was given. 30 was given. Not 200, 30 was given. And I asked the people that you please to inform me on the next day by 12 o'clock. Because I am not sure the drug is going to act if something is given to change or like that. But no phone call came actually. And meanwhile, I also forgotten to ask them, and I didn't have collected their phone number also, that I should do. So the clinic for morning, it was over. I came in the evening, again the clinic started. Around about 7:30, again the people, the boy, his grandmother, his mother, his father, his auntie who is living nearby, all the people entered to my small clinic. And I find that the boy was absolutely fine. The acute had gone. I asked when this thing happened. Because he didn't make any phone call, so I felt my drug had failed to get any relief to your child. But they say, no, doctor. It had gone at night only after 1 or 2 doses, because it was 10:30, so single dose was given most probably. And in morning they had given another dose. In morning it was very less. And gradually after 12 o'clock, no rash is there. So I hold the medicine. I gave him placebo. Let us see the effect. So 5 or 6 days is over. The boy is completely perfect. So when even the steroid cannot reduce the acute urticaria, our homeopathic drug can do this thing. So it is a nice experience. A small case of a boy I must share. When he entered to this clinic, our mother complained, doctor, he has got 2 big tonsils. And it is since many days, pediatrician told it to cut off. But I have heard from someone that tonsillitis has got a very beautiful treatment from homeopathic side, whether you can do. Boy was fatty, flabby, sweats a lot. Sweat has got, as if he had studied the mathematics and came to us. There is some sour smell, protruded abdomen, desire for eggs. So quite naturally this is a case of calcarea carb, I thought, and calcarea was given. The boy came after 15 days, there was no remission. Size was as it was. And you believe me, this was like marbles. I was astounded where from the food goes. A second very haunting thing was there. Yeah, how he can take food. Does not it pains? The problem is that the mother could not really convey it. She said, no doctor, he doesn't complain of pain. Probably he is having since so many days. So if might there be pain he cannot understand, or he might have taken it is a part of his life. The pain should be there. So no pain sensations. I'd gone with calcarea because the picture was so clear. So 1.5 months is over, there is no remission. So it is a time to think. So painless. The boy was jovial, used to laugh, used to dance, sweats a lot. Sleep was good. During the time of sleep, his eyes become half open. I thought, yes, I was in mistake. I have got this clue because half eye open with these all symptoms shoots to opium, painless. Opium was given. Opium also couldn't bring any relief to this case. I do not know whether the patient was waiting. Because if I would have been a father, I used to live. Because already 3 months were over. There was no remission. One day again the boy came and I was in very poor mood because there was no remission took place, etc. etc. And what happened that day? The boy demanded water from his mother. Mother had given the water, and what I have seen, while drinking the water, there was nasal regurgitation. I didn't have took it seriously. Take it seriously. Because probably with the hurriedness, it had come down to nose. It comes from the nose. With few sneezes, the boy become alright also. But our mother gave one very important clue. She says, Dr. Saab, many times this thing happens. While he takes water, that comes out from his nose. I took it seriously because if this is persistingly happening, so it is having some meaning. So I have to search one drug where the tonsil should be painless, and as well as there should be nasal regurgitation of liquid, water, milk, he said, as his mother said. The boy had got some kind of bad smell from the mouth too, but it was not confirmed whether that was on that very day or it is there. Anyway, I forgot everything. All the remedy had failed to work. So I prescribed diphtherium 200 to this case. And when the diphtherium was given, with all the lost hope, if it worked, something like that. And diphtherium, because that time I was given calcarein, 01 potency, 0203, opium, that too in 03, 04, 05, something like that. Diphtherium were given in a 1 gram globule, take it twice. How many days the bottle doesn't finish? I should not do this thing, but you know, being a physician also, when you are not giving result to this case, so it becomes very difficult to sit in front of the patient with a lot of question in their eyes. The doctor, why it is not going to happen? The boy came after almost 1 month. I thought the patient left. Again the boy came. I asked what happened. Till days I thought he then left me. But I told, ask whether he had gone for, no, that time there was Ramjan mine also. So that the reason might there not become. So I calculated in that. Her mother said, why should we come, doctor? You see his throat. It was just came down to the very too small size. So what these so-called constitutional remedy couldn't fail to do, that was done by diphtheria. So thank you for your patience listening. I will come with the dealing with acute or handling acute, the second phase on another Friday I will choose. So thank you so much. Good night. Thanks.